Major changes are coming to Medicare Advantage in 2026, and probably the most alarming news is that over 1 million Medicare Advantage enrollees will lose their coverage on January 1st. Yes, you heard me, 1 million people. If you're one of those people and you don't do anything about it, you could be on the hook for 20% of all your medical bills in 2026, which puts you at a very high out-of-pocket risk. This is why I'm going to explain to you everything that's going on as we know it right now, and I will show you what you need to know if you are affected and what to do if you are one of the 1 million people that is being affected. Okay, let's start with what's happening and what we know today. Several insurance companies are dropping some of their Medicare Advantage plans in certain areas. For example, we have already received an announcement from United Healthcare that they are dropping Advantage plans for over 600,000 people. This is the largest Medicare Advantage insurance company in the country. Here's another one. Elevance. A lot of people hear Elevance, they don't know what that is. Elevance, formerly known as Anthem, is pulling back on Medicare Advantage, and it's saying that there will be 150,000 people who are affected. They are also pulling out of standalone Medicare Part D plans completely. So if you have an Elevance, known as Anthem, prescription drug plan, you will not have that next year. And here's another one. The company known as UCare in Minneapolis or Minnesota is exiting Medicare Advantage entirely and laying off employees. Reports say that that could affect 150,000 people who have a Medicare Advantage plan with UCare. There will be no UCare Medicare Advantage plan in these areas in 2026. Now, there are also some reports saying that Aetna is going to be closing down 90 of its plans. We don't know how many people that will affect, but that's across 34 states. And I'm sure that there will be many other insurance companies that follow. This is just what we know today. Now, one thing that most of these plans have in common is that they're mostly shutting down their PPO plans. And if you know the difference between an HMO and a PPO plan, well, first let me say, you probably already know that the HMO is the most common Medicare Advantage plan, but HMOs are not so far as affected, but PPOs have been very effective. So what is the difference between the HMO and the PPO? Well, on the HMO side, you typically have a tight network of doctors. You can't go out of network. If you want to go out of network, there is no coverage. So it's only in-network coverage, typically with an HMO. And then you have copays when you go to your doctor. With the PPO, you have your network, but you can go in and out of network. And the thing with that is that it's hard for an insurance company to control the costs. And so in many cases, the PPO plans have not been performing well. They're costing the insurance companies more than the amount of money they bring in from the government. And so consequently, a lot of PPO plans are just not making enough money. Now, let me know what you think about that in the comments, but whether you like it or not, it's completely within their rights to do this. And it's not just their rights, it's the cost, right? If it costs more to provide this to you than they receive in money, they just can't continue to do it. But now that you know what's happening, here's the big question. How will you be affected? And how will you know if you're affected? If you're feeling confused about Medicare, don't worry, you're not crazy. It just is that complicated. And that's why I created a workshop that makes Medicare simple so that you can confidently choose a plan. So you can click on the link on the screen to learn more. Okay, back to the video. I'm sure you're aware that if your plan is closing and you don't do anything about it, you'll automatically revert back to original Medicare and only have original Medicare on January 1st. And trust me, you do not want this to happen because you'll be on the hook for about 20% of all of your medical bills. You won't have coverage for your prescriptions, and there's no limit to how much you would have to spend out of pocket. So you certainly don't want to go back on original Medicare. Plus, you really need to be extra careful here because there is only one letter. That's right, one letter that your insurance company is required to send you if they're just completely closing your plan. And that one letter is called the Annual Notice of Change Letters, or ANOC. The ANOC letter is the only letter that they're required to send you to say that we're closing your plan. Now, we call it the ANOC for short, and that's what I'm going to refer to it as here. You should receive this letter or your ANOC in the mail by September 30th. If you have not received it by September 30th, then there is a problem. You need to call your insurance company. Now, this letter will tell you what is changing. It'll tell you the changes for the next year, changes for 2026. And you need to know what those changes are, including if your plan is going out of business. Because remember, the ANOC is the letter that's going to break the news to you that your plan is ending. So look out for it. Now, what do? SOS, I haven't received the letter. Well, call your insurance company. If you call your insurance company, just take your card out, turn it over, look at the phone number on the back, call that 1-800 number and say, I have not received my annual notice of changes. Then they can get that information for you. And then you will know if your plan is changing. So again, receive it by September 30th. It tells you what's happening for 2026. And if you haven't received it, call your insurance company. Now, if your insurance company is not going out of business or not closing up their plan in your area, you still need your annual notice of changes, because it tells you a lot about what's happening with your plan. And we know that some Medicare Advantage plans, unfortunately, are going to be worse in 2026 than they are today because of the Inflation Reduction Act and the usage and everything. So some insurance companies are losing money on their plans, and they're not closing. They might have to increase the cost for you or remove certain key benefits. So keep your eye out for the annual notice of change. Now, let's say you do receive your ANOC and you see that your plan is having significant changes. What do you do about it? And if indeed it is closing, where do you go now? The good news is that it's actually quite easy to switch to another plan in your area. It's not as hard as it sounds, and you'll be okay, I promise. But you need to know about the annual enrollment period. Many of you probably already do, so I'm going to go over this quickly. But your insurance company, first of all, is probably going to contact you and try to get you to join another plan that they offer. But you don't have to. You could switch to any other plan available in your area, either with the current insurance company or with a new insurance company during annual enrollment period. But before I show you that, let me just jump in here and say that if you're finding this video helpful, then please hit the like button. We are creating great content every day, and we need more people to see it because more people need to know what's happening. And be sure to subscribe as well, because we are expecting some more big changes for Medicare in 2026, and we will keep you in the loop. All right, I'm going to go back to explaining about annual enrollment period. AEP, or annual enrollment period, it runs every year from, I feel like this is the thing that everybody already knows, October 15th to December 7th. Don't miss the 7th. It's not the 15th. It's not the 30th. During this time, you can join or switch to any Medicare Advantage plan, any prescription drug plan that's available in your area, and you can make changes during this time. So what can you do? Well, you could change companies or plans for your Medicare Advantage prescription drug plan or your prescription drug plan, MAPD, Medicare Advantage prescription drug plan, PDP prescription drug plan. Now, if your Medicare Advantage plan is closing, you will also get a special enrollment period that I'm going to talk about next. Now, during this time, you're going to make a change and make a decision, and whatever you do, your plan, your new plan, is going to start on January 1st, 2026, or the following year. So whatever you do starts the next year. You make the decision from October 15th to December 7th for the plan that you're going to have next year. Now, for those people who are losing their plan, it's not the end of the world if you miss this. I wouldn't recommend you miss it, but it's not the end of the world, because you will get a special enrollment period to help you make a change because your plan has gone out of business. So let's talk about what a special enrollment period is. A special enrollment period means that something unique has happened. In this case, you lost your plan and you have the opportunity to change plans. And it allows you to join another Medicare Advantage plan past the usual December 7th deadline. In fact, this one is going to run. So the special enrollment period, if in this case, we're going to say you lost your plan, that's the if, then what? You can change your plan. You can join another plan outside of the annual enrollment period. You could join another plan when, okay, here's the critical thing. This runs from December 8th. So starting on December 8th, you get the start of a special enrollment period because you lost your plan. And it is going to run to February 28th. So this is outside of annual enrollment period. It's a special window for those who lost their plan to change. So if you use this special enrollment period, when does your plan start? Well, it's going to start on the 1st of the month. And I'm not talking about, obviously not the month you're in, it's the following month. So if you use it on, say, December 8th, it's going to start January 1st. If you use it on January 8th, it's going to start February 1st. If you use it on February 28th, your plan would then start on March 1st. So if you miss your window, let's say that you did the February thing, well, from January until March, you're on the hook for the 20% of Medicare because you're going to be back on original Medicare. Now, keep in mind, this SEP is only for people whose Medicare Advantage plan is going away and who want to make a change to their coverage after the December 7th deadline. So only those people get it. Now, here's one little secret. If you're losing your Medicare Advantage plan, you could actually take advantage of what I'll call a loophole. And instead of going to another Medicare Advantage plan, you could join a Medicare supplement plan with no questions asked. And for some people, this might be a good thing to do. Most of the time, if you want to switch from a Medicare Advantage plan to a Medicare supplement plan, you have to go through health underwriting. You can't just do it anytime you want. Health underwriting means you need to medically qualify for it. However, if your Medicare Advantage plan is closing, you'll get something called a guaranteed issue right, or GI right. Your guaranteed issue right means that you can change to a Medicare supplement plan without questions. Because usually if you have an illness like heart disease, cancer, or you've had a recent stroke or been hospitalized, a Medicare supplement plan can flat out deny you. They can say, no, we're not going to accept you. But if you have this guarantee issue right, then they are legally required to take you with no questions asked. So why would you get a guaranteed issue right? Because you would get a guaranteed issue right because your plan is canceling on you. And because your plan is canceling, you qualify for this special loophole or window where they have to accept you with no question asked. So what is it? It is the guaranteed right to get a Medicare supplement and not be denied. Which plans can you use to get a guaranteed issue right? Because it's not all of them. You can use the guaranteed issue right to get a plan A, B, C, D, F, and G. Most notably, there is no guarantee issue right for the plan N. So no plan N. You can use this guarantee issue right if you're losing your plan, your Medicare Advantage plan, to get any of these plans. Like if you've been on Medicare long enough, you could get the plan F. If you're more recent, you could get the plan G. Now, when can you use this? Well, you could use this guaranteed issue right 60 days before or up to 63 days after the event. In this case, get a little far from me, the event is your plan canceling. So you've got 60 days before and up to 63 days after to use your guaranteed issue right. And for some of you, you really should consider that. If you were on the Medicare Advantage PPO, maybe it's time for you to consider going to a Medicare supplement plan instead, because your options in most cases are going to be go to a Medicare supplement plan or go to an HMO plan. So if you're one of the millions of people affected by these plan closings of Medicare Advantage plans, don't panic. Look out for your ANOC, read it, and understand what's changing. Contact us here at PlanFit if you need unbiased help to find a suitable replacement for the plan that you have now. And also, if you're thinking about your guaranteed issue rights and you're thinking about switching to a Medicare supplement plan, but you're not sure if you can afford it, then check out this video next where I go over a real cost comparison between Medicare Advantage plans and Medicare supplement plans.